Good morning, everybody. And before I start, I just want to say to all my Muslim friends out there, today's the start of Ramadan, the month-long holiday. So my wishes are with you for this month, and blessings of this holy month for you. Unfortunately, we had another resident pass away last night, which brings us up to 31. A gentleman in his 60s, passed away, and my heart and condolences goes out to the family. Our thoughts and prayers are with you, and to the other 30 families. And unfortunately, this person was a resident of our nursing home, and he was at St. Peter's for care, for underlying issues, and like everyone else in our nursing home, they're a family. So, and to the workers out there that know that are standing by everyone out there and helping them and taking care of them, it's hard on everybody as well as the family. So we always hope when someone goes to the hospital that they come back regardless of their situation and the condition that they're in. But again, our heart and our condolences goes out to the family and to the other 30 families. As of today, there's 784 positive cases. There's 753 people under mandatory quarantine and 54 people under precautionary quarantine. As of yesterday, as you know, there were 739 positive cases and 772 people under mandatory quarantine, and 54 people stays the same for precautionary. Shaker Place now has a total of 27 residents who have tested positive, 13 employees who have tested positive, including one who has recovered and returned to work. As you know, we've been very aggressive out there testing not just the residents, but testing the workers to make sure if they have any signs or symptoms, we address it and we take their temperature. And before even the governor locked down nursing homes, we locked it down beforehand. And we have taken every measure that we can. And the issue is, and we've talked about this, as more and more people need PPE and more people need stuff. I'm saying if anyone has stuff out there, we need it. I know we need medical gowns, we need gloves, we need masks, we need everything that you can give us to help out to keep our workers safe first and foremost, and our residents. So that's one thing we keep putting up to the chain of command through the state is that we do need more supplies for our nursing homes. So hopefully that's going to be addressed. And, again, my condolences and everything goes out to the families. So as of today, we have 1,902 people that have completed quarantine. 431 tested positive for the virus have recovered. There are now 30 people hospitalized. We're down 1 from yesterday. And with a hospitalization rate of 3.83%, and that's down from 4.19 yesterday. There's 7 adults still in the ICU, same as yesterday, that didn't change. 15 males, 15 females. And I do want to say with the testing, we've been aggressive at Albany and with our mobile testing sites and with Rate Aid. So our mobile testing sites, we've tested 370 people so far. Since we launched this that have come back. And some of the breakdown, and we'll put it on the chart to talk about some of the testing breakdown that we came down to, and we're breaking it down so Dr. Whalen and her team can do the mapping and tracing. So far, out of the 485 people signed up. And yes, only 300 and some people got tested because of the signs and symptoms. You can't test everyone that just wants to walk in to get tested because testing equipment is limited. But out of all that, 40 people that filled out the questionnaire refused to put down what race they were. 3 people were Pacific Islanders. 4 people were more than one race. 5 people were American Indians. 9 people were Asian. 6, that's the same thing there. And a total of 151 Caucasians and 187 African Americans that went for the test. Out of everything that has come back so far, and you got to remember, it takes time for the test to come back. Out of the 250 tests that came back as of yesterday, so you got to remember this data is only updated when we get numbers back. Out of the 257 people that tested since we've launched the mobile testing sites, 17 have come back positive out of the 257. So a ratio of 7% that we're seeing. So We break that down, and that should be on the website. But some of the things we're seeing with the mobile testing site, with the mapping and tracing, that's kind of interesting, is who's getting tested, right? And we're looking at the age groups. So in which I pointed out the other day when we launched the COVID-19 site. When we launched that, I talked about the age group between 20 and 29, that it was higher than the age group from 60 to 69. So so far, the age group who have tested, 72 were between the ages of 20 and 29, 95 were between the ages of 30 and 39, and the biggest age group getting tested was between 50 and 59 at 99, and it breaks down, and that will be on the website, you know, of all that. So the drive-through at Rite Aid has been going well. I encourage people to continue using it, and I can't thank the supervisor, Mahan, and everyone out there for their efforts. I can't thank the sheriff enough for all his efforts doing the security and working with us in a partnership with the mobile testing sites and helping us get everything done around the county, and especially with the PPE. Thank you, Sheriff, as always. And, you know, as we talk about self-isolation and practicing social distancing and wearing masks in public, there's options out there. There was some of the questions we got again yesterday. You know, so again, people, you just got to figure out what works for you, you know. You know, a little bit of science behind it, some of it, but please figure it out. To our friends and loved ones through this difficult time, you know, listen, we don't want people to think we're taking this lightly. We're not trying to scare people. We're not trying to fearmonger. And trust me when I say we want to make sure we open government and we get moving in the right direction. Everyone wants to get the economy moving again, but we have an obligation for your safety and health of the people. And it's tough. And I'm not a scientist, so I'm not going to argue. People were sending us stuff yesterday. I can't argue the guidelines for CDC or the flu or any of that stuff. I can't. It's not my job. It's a pay grade above me. I leave it to the scientists. I leave it to the doctors, like Dr. Whalen and her team. You know, so think about that as you're going forward. You know, the CDC is talking about a second wave. Again, people are going to say I'm scaring people out there, right? They're talking about the second wave coming in October is going to be worse than what we're going through now. We're not even through what we're going through. So I'm just telling you, we're following this like everyone else. It's simple, you know. Just go on out, do your reading, go through the CDC. Like I said, go to a trusted site, and you can see what we're watching. And I think Dr. Whalen said it the best in the beginning. You know, look what's going on in Italy. We're probably 2 to 3 weeks behind them. We look at what's going on over there. I look at what's going on around this world. I look at what's going on down in New York City, New Rochelle and Westchester, and Putnam County, and Orange, and Dutchess, and you just simply figure what they're going through, and we're a little bit behind them. So in certain cases, we're above them, and as you see, our numbers are going to steadily climb more than anywhere else because of the testing that we're doing versus other places. So you will continue to see a change in that. We'll be judged tomorrow for what we do today. I don't know how many times I've said that to you. Our actions today will be judged tomorrow. I keep saying this, it's a marathon, not a sprint. Take your time, take a deep breath, take a step back. The world's changed, it's changed. And I know people have a lot of anxiety. I know people have a lot of issues. And I know a lot of people don't feel it because they don't know anyone this has affected. And thank God you don't. That's all I can say to you. Thank God you don't. But think of the 31 families today in Albany County and how that's affected their life. And yes, you can say they're underlying health conditions and they're, you know, had issues going on or they're in hospice. Still not a good feeling, people. You can justify it all you want. And then you think of the cases that people didn't have underlying health issues. But on the other thing, when we're seeing the enforcement, and we talked about this, myself and Sheriff Apple and David Soros, our district attorney, when we talked about price gouging and watching that as we go forward, we have been, the three of us, been communicating between our offices on what everything is going on and the restaurants. But I kept getting questions like that, and Sheriff and I go back and forth with it all the time, but that's his area. So who better than to talk about it than Sheriff Apple? Sheriff Apple.
First of all, thank you, Dan and Liza, for all the great things you've done to keep this county safe through this mess. First of all, I want to take a second and commend the administration up at the jail, because if it wasn't for the efforts that they took early on, like March 1 and 2, who knows what kind of mess we would have inside that jail. To date, we've still had no inmates test positive. We've had no correction officers test positive. We did have a jail nurse test positive and 2 deputy sheriffs, all who have returned and are healthy. So it was those steps that they took early on that I believe has kept it out of the jail and probably saved lives. So I want to thank them. I also want to thank our logistical division at our EOC out in Clarksville. Chief Paris and the deputies from downtown and the airport that were pulled out to assist have done a marvelous job of disseminating literally hundreds of thousands of masks. Yesterday alone, we shot out 7,000 masks in small kits that we've made out for the general public, 2 packs of cotton masks, over 60,000 N95s, over 100,000 cotton masks, something like 7,000 or 8,000 gallons of sanitizer. The numbers are astronomical. So I want to thank my staff. They've all stepped up, and I couldn't be more proud of them. To date, we've received roughly 70 complaints regarding congregating or non-essential businesses operating. As I'm sitting here on my phone, I just got another one, and we'll follow up on it. I will say that we have not had to make any return visits. Everybody has taken the warning and backed off. Of the 70 complaints, only 5 individuals actually left their name. So we were getting some that were just total BS complaints, people telling us that businesses were packed and serving beer and food at the bars when in fact they weren't even open. So all that does is waste our resources running around chasing false leads. So in addition to that, I will say that I'm extremely concerned once this coronavirus does in fact settle down in Albany County. I'm extremely concerned about the mental health issues that are out there. Early this week, we had to literally talk a lady off the ledge at Thatcher Park, 64-year-old female, pretty much upset over not being able to move about or see her grandkids, and that's pretty damn sad. And I think we're going to see more of that. I think we're going to see a lot more issues pop up when, in fact, people can be evicted from their homes and apartments, when people go into foreclosure, when some businesses do not open back up. I think we're going to have a lot of issues. So it is of great concern. So please take advantage of the numbers that the county executive and the county has posted numerous times regarding Albany County mental health, our crisis hotline. You can call 211, they can find help. So it's very concerning. So I do have a few masks, some kits up here to show you if you want to see when the press conference is over, if anybody wants to take a look. Today we are at both ShopRites on Central Ave, Upper and Lower, and the Shop and Save in Ravenna, handing out 2 packs of these, the masks, instructions how to wash them. Do not throw them in a dryer, let them air dry, and then you can use the other one in the meantime. So we're doing everything we can do to keep you safe, but honestly, a lot comes down to personal accountability. You know, people are still congregating in areas, people are still packing in to pick up their food at restaurants. You need to spread out. Safe, be a safe distance, 6 feet. Some say 6 feet's not enough. But if we want to flatten the curve and we want to stop the spread, we all need to be responsible. So thank you.
Sheriff, thank you. And Dr. Whalen.
Thank you, County Executive McCoy, and thank you, Sheriff Apple. I think it's such an important role to be able to get additional masks out to the public. And I think that, you know, again, what we want to highlight on with face coverings and masks, when you wear a surgical mask or a homemade face covering, what you're really doing is protecting others from germs you may be carrying. So people that have a tendency to say, I'm not worried about COVID, please realize that you're putting this on for other people. It is protecting other people from your germs when you wear a mask. That's what we know that these face coverings do best, is source protection. So please, going back to what County Executive McCoy has said time and time again, think of the people that you're trying to protect. Please do not go against recommendations in public or when you're with others in a workplace or other public venues. Wear your mask. Wear your mask. It's important. I wanted to talk a little bit again about the numbers. We've had a lot of positive feedback on our database that we've launched on the county website, and I wanted to share with people that we are working with a company that we have contracted with to get more granular information out, which we hope to release next week. That information will contain more breakdown on demographics related to those that have been in hospital, those that have been in hospital that have been in the ICU, and the death data. There's been a lot of interest about our death data from a racial demographic point, and I can tell you out of the 31 deaths that we've had, 7 have been African Americans. So this is about 22%. It is higher than the rate for the county, and we are continuing to follow this actively, and we'll follow it also in our hospitalized patients. Yesterday, at the time of our press conference here, we talked a little bit about the Sero prevalence study that was done by the New York State Department of Health. What this was, again, was a study of antibodies. So this wasn't a test to determine who had COVID, but rather who could demonstrate an antibody response to COVID. So that meant that we were looking for markers that indicated that people had had an immune response to the disease. They sought by doing this to test people that had not been diagnosed. So by doing this, to gain a little bit of information about people that may have had it, that may have been asymptomatic. The report, which came out, the preliminary data came out shortly after our press conference yesterday, is that 13.9% of New York State residents surveyed had positive results to the antibody test. However, there was a great variation across the state of this percentage number. Areas in New York were as high as 20%. But importantly to us, the upstate area was 3.6%. So this is good news and it's bad news. Good news is this low result means that a lot of what we're doing with the social distancing and staying home is working. The bad news is that what this infers to us is that the vast majority of residents are still not immune to COVID-19 and are therefore still susceptible to it. So we know that the actions that we have been taking have prevented this number from being higher, but it's important for us knowing how we go forward as well, to know that there is not a significant amount of individuals that have protection from an antibody perspective. This makes it all the more important for us to be very conscientious about the work that we're doing about infection control, about important and meticulous hand hygiene, wearing masks, and ensuring that we are doing our bit to prevent spread in our community. And we look forward to hearing more about this from a state perspective in terms of how we will move forward with this. We know that this is going to continue until we get to the point where there is a significant amount of immunity in the public, or until there's a vaccine, and the vaccine is likely not at least another 12 months out. So, so the timeline is extended, and we need to look at how we are acting each day so that we can influence the numbers going forward. What we're doing is working. What we're doing is working, and we need to wait for more information to determine how we can roll out getting back to some semblance of reopening in the community. So we look forward to continuing to follow along data. When we look at the cases coming in at the local level in Albany County, we're still getting 20 to 30 positives a day. We're still at that plateau level. We're still following that on a daily basis. We've had, over the last day or so, a few less tests. We had about 300 tests on a daily basis. Yesterday, that number was lower. It was about 100 I think around 150. Whether that's a blip or whether that is a downward trend, we'll continue to monitor that as well. The numbers and evidence and science have to be our guide going forward. So for the moment, the focus is still on continued community mitigation efforts, and we'll continue to follow along.
Dr. Whalen, thank you to you and your team as always. You know, it's always hard to put some good stuff out there, but it's good news with bad news. Our sales tax revenue is down with less people out shopping, obviously. So far, we're seeing about a 12% drop in our revenue, which can amount to about $30 million. So funding is always crucial, and some of it we got from the federal government. I was talking to Senator Gillibrand yesterday, and I want to thank Senator Schumer for securing over $58,000 for the Albany County Courthouse. It goes to the courthouse as part of the CARE Act, and it's for PPP and other equipment and for law enforcement overtime. So, which is good. You know, it's going to help. Everything helps. I'm excited about $58,000 if it tells you. I mean, it's just, again, anything at this point in time is going to help us with our bottom line. So thank you to the two senators for doing that. Also, Department of Aging, as we're dropping our mails off to the seniors, thanks again to the sheriff and everyone else. We're going to be giving our seniors their mask. So they have one when they get their mails delivered to them. So thank you to Deborah Tano and the Department of Aging and everyone else. And as always, when we talk about the anxiety and how you're feeling and not adjusting to the new norm, please, our mental health line is there, as always, 7 days a week from 8 a.m. to 8 p.m. And again, the number is area code 518-269-6634, 269-6634, and always the 211 in the New York State hotline.